Good evening, everyone. Thank you for joining us this evening for Student Pro Connect's kickoff of the Real Deal with Student Pro Connect. Student Pro Connect is a social networking site where students and industry professionals can connect. If you're a student or someone looking to make a career move, you will be able to find valuable insight firsthand from people in the field. If you're a professional, this is a great way for you to give back and to share your story to inspire the new generation. The purpose of tonight's segment is to provide the real deal behind what it takes to start and thrive in various fields. Every 30-minute segment will feature an industry professional telling their story and sharing their insight. Now, if you haven't done so already, please sign up on Student Pro Connect by either going to our website, www.studentproconnect.com, or downloading our app, which is available both in Google Play or the App Store. Without further ado, please join me in welcoming our guest for the night, our first guest, Morianne Joseph Dirigen. She is a nurse practitioner and she's been in the field for over 10 years. Welcome, Morianne.
Thank you. Well, thank you for having me. I'm so excited to be here, to be able to speak to you Student Pro Connectors. I'm just truly excited to have even been invited to kind of speak about the field and how I came into the field, and to answer any questions that you may have, or if you have any hiccups or concerns, whatever those may be. I'm here to give you the honest truth.
Thank you so much. We're so happy and so excited to have you, especially as our first guest. So let's get into it and let's start talking about the nursing profession. So according to the Bureau of Labor Statistics, they're predicting a higher than average growth rate for jobs in the nursing profession through 2022. And as far as growth rate is concerned, nursing is surpassing other professions across the board at 19%, the others at 11%. And it's predicted that in the 10-year period, over 500,000 new nursing jobs will be added. So this is definitely a field where there's a lot of growth. There's no decline. Would you agree?
Absolutely. So I can remember even when I was in college, just hearing about, my, high school classmates going into the nursing field. And at that time, I just kind of didn't really think much of it, but it's something that you always hear about. You have friends, you have family members that are in the field, but you never really go into the nitty gritty of how diverse the nursing field is. And there are millions of people practicing nursing. And I would say that if there was ever a time to join or to enter the field, now would be the time. And it was popular then, and it's still very popular. And you'll notice that when we have different pandemics, you'll have an influx of people joining the field. So this is a great time for anyone that wants to join the nursing field.
Yes, for sure. It's definitely a time of great opportunity in healthcare overall. But looking at nursing, I had no idea that there were so many different nursing roles in the field. I mean, there's over 20 different roles, with nurse practitioner being at the high end with an average salary of 115, but there's just so many options. I mean, there's traveling nurses, there's labor and delivery. I mean, I had no idea there was so many.
Yeah. And so what's interesting is that, again, when I was a lot younger, I just kind of thought of nursing as just being kind of the ones you see at the hospital, whoever you see at bedside caring for sick people. But in my years of working, I've kind of interacted with so many different people. And like you said, there are travel nurses, there are, nurses that work in, the emergency rooms, or if you want to do clinical research, you can be a clinical research nurse. So the thing is, the nursing field is so diverse, and it honestly never goes out of style. You can reinvent yourself also. If you decided that you wanted to start as, let's say, a nurse in a hospital and want to transition to a clinic, or later like become your own entrepreneur and have your own like home care health nursing agency, you can do that. There's so many things that you can do in the field.
Wow, that's amazing. I had no idea. I mean, if you're just looking at the screen of all these different professions, now one thing I do notice is the education. So there are differences in terms of education. And we have this great pyramid here. Can you break it down for us?
Yes. So this particular slide is one that I'd like everyone that who's listening tonight to really like, you should keep this in your like repertoire of like just things, because this tells you everything you need to know about nursing. So when the nursing field initially started, so it actually started like with diploma nurses. And so diploma nurses were nurses that were trained at, let's say, a hospital. And normally they were trained by physicians. So there was no real like theory in terms of what they were learning. They were kind of like taught, this is what you do. This is what you do. When you see this, you see this is what you do. So again, most of the diploma programs have essentially been phased out. So if you see any type of a program that's kind of run by a hospital at this point, it would most likely become, it'd be more of an associate degree type of a nursing degree. So moving along, so they're practically have phased out this diploma type of licensure. And so you'll find that what we typically talk about are the associate degree nurses or bachelor's prepared, master's prepared, or doctorate degree nurses. So at the associate level, what's nice about that particular degree is that it's a 2-year degree. You can actually obtain this particular degree at a community college. There are some schools that offer it like, you know, through a trade school. So when you're typically, this is one of those programs that's very, it's a very, how should I say this? It's not very expensive. So the cost point for it is, it's very reasonable, but it's one of those programs that's so popular and it's very hard to get into. So you'll find that with a lot of community colleges, they have a lot of prerequisites for you to get into the program. Whereas when you're going into a bachelor's prepared type of a program, there's a bit more flexibility with being able to obtain a degree. But the point that I want, you know, for you, those that are listening, to take home here is that there are a lot of like, how should I say this, like boutique type of nursing programs. So at the associate degree level, you want to be very careful where you get this degree. What's nice about the associate degree nursing degree along with the BSN is that you take the same licensing exam to be able to practice. So the licensing exam is no different. They're exactly the same. The only difference with the BSN is that they give you more theory. So you're applying more of the theory aspect to kind of your nursing care. So this is where they are introducing nursing theorists to you, and you're adopting a particular nursing style in how you treat your patients. But just be careful, like if you're, because what you'll find is that a lot of the boutique type nursing schools is that they'll offer you a great package saying, hey, you'll be able to graduate from our program like within 16 to 18 months. But you want to really, really look into their history and check their pass rates, because what you'll find is that a lot of times some of their pass rates aren't necessarily the best when compared to a community college. So in my opinion, if you're thinking to do the associate degree program, please do your research and really focus on trying to go to a community college, or if you decide that you want to do the boutique type of training, to make sure that the pass rates are pretty high and that you're going to get what you need to be able to take to pass the licensing exam. So the newest thing that's happened in the past couple of years is that at the BSN level, they now have an accelerated program. So BSNs were typically 4 years, usually degrees that were given at a 4-year college. And now what's happening is that we have an accelerated option where you can actually get your BSN degree in like between 1 to 1.5 years. Again, the licensing exam is no different than the associate degree. They're both the same exam. But what's nice about the BSN is that, again, because you have theory, you'll find that there are a lot of hospitals that are kind of, so there are different hospitals that have different tiers of nursing excellence. And so when we're talking about nursing excellence, there's this kind of grading system that certain hospitals have. So when you hear that a hospital's magnet status, what they're essentially saying is that, you know, they have these amazing nurses that are usually mostly BSN they have BSN degrees that also like use theory and how they're caring for their patients. So the next step up is the master's degree. And so what's nice about the master's is that you have flexibility. Like you can kind of go into different areas of nursing. So at the master's level, this is for those folks who decide that they want to become nurse practitioners. You can also become a certified nurse midwife if you want to be a more specialized nurse in the hospital, more kind of acting almost in the role as a hospitalist. You can go and become a clinical nurse specialist. They have certified nurse anesthetists, which are kind of similar to like the anesthesiologists. So they function in that role. At the MSN level, also you can function in the role of a nurse educator. You can become a school nurse, or you can become a clinical nurse leader. A lot of times you'll find that nurse managers that work at a hospital usually have like at least a master's degree. At this level, there's really no board exam necessarily, like in terms of licensure, but there is, like, if you're specializing. So let me just take it one step back. When you've gone into becoming a nurse practitioner, there are different, how should I say this, categories. So if you're thinking that you want to practice family, meaning that you're treating the entire family from infant to adult, you can become a family nurse practitioner. If you want to focus on women's health, you can do that. If you strictly only want to deal with kids, you can become a pediatric nurse practitioner. And then it kind of goes on. Like if you want to do emergency medicine, acute care, you can kind of go into that specialty. So there are different specialties within the NP realm. And at that level, they do have a board certified exam. So what you're saying is that when you take that next exam, what you're saying is that you're board certified, one, as either a family nurse practitioner or a women's health specialist and so forth. So there's really no licensure, because the licensure that you've held as either an associate degree nurse or a BSN, those are the ones that you would still kind of have moving into the MSN. But again, moving into the MSN, usually you have to be at least a BSN level. And again, they do have accelerated options. So I'll tell you my story like in a little bit, so I can tell you how I actually moved into the nursing field. But let me just finish off with the last part, the doctorate level. So in the last couple of years, the nursing tradition, they've kind of, I want to say, kind of been looking at various disciplines such as physical therapists, and even the pharmacology field. And a lot of them are now at a doctorate level. So they also, were along the lines of thinking that, what, we should kind of more professionalize our field and also create a doctorate. So this new doctorate kind of started a few years ago, and they had other doctorates before. As for example, if you wanted to become a PhD or to have a doctor of nursing sciences or even a doctor of nursing, those did exist. But the DNP is something that is fairly new. So it's a doctorate of nursing practice. And that particular degree is more of a clinical practice degree. So when you're thinking of PhDs, those are people that are kind of like really doing research to kind of impact change. But when you're thinking of a DNP, which you guys probably see like commercials all over the place about various DNP programs, those are clinical practice degrees where the work that you do is more related to clinical settings, clinical practice, and impacting change or creating programs or projects to change how the environment of your clinic is run. Like if you want to create a project to, let's say, improve the number of infections that you have at your hospital, the DNP would be that could prepare you for that.
So is that,
and again, I'm sorry.
So would that be more research based?
So the DNP has a little bit of research, but the PhD is more of the research-based doctorate degree.
Got it.
Yeah.
Okay. And real specialization comes through at the master's level. That's when you really
yes, exactly. Exactly.
Got it.
Now, it's not to say, before I'm sorry to cut you off.
Go ahead.
We do have BSN nurses that can be certified in oncology. So there are several specialties that you can obtain at the BSN level.
Okay.
So if you decide that you want to go into oncology, you can do that. If you like hematology oncology, there are certain certifications that you can receive at a BSN level for that.
Got it. Now, I know in a lot of other fields, they usually say, you really not competitive unless you have a master's degree, right? You have to kind of get take that step up. Is that the same in nursing? Do you have to go past that bachelor's to be competitive?
Well, it actually depends. So I would say it depends on where you'd like to see yourself in the future. Like if you're satisfied with working at a hospital and you decide, let's say, for instance, you decide that you want to go into teaching. Like I actually wanted to do that at one point. And when I lived up north, it was fine for me to do that at an MSN level. But we're finding that because the field is becoming more professionalized with a doctorate, there are a lot of schools now that they're requiring you to have a doctorate degree to be able to teach.
Got it.
Yeah.
All right, so let's get into your story. So you kind of broken it down for us, which is great. So now we can kind of put it all in perspective. And now we can talk about how you got to where you are. So education-wise, I see you went to Boston University, you got your Bachelor of Arts in Psychology and Biology, then you went on to get your MPH at George Washington University. And then you went on to do a Master's of Science in Nursing at MGH Institute of Health Professions. So kind of take us through that, how you kind of decided that and just your whole education path.
Yeah. So when I left high school, I was a little cocky, to say the least. So I was in a couple of AP courses and kind of entered college with this idea that I was going into medicine because I kind of like had the 4.0 and just kind of, thought I just had it all. And then, of course, when in my first year of college, I was sadly mistaken. And I was a bio major at the time. And in my first semester, I just kind of like, it was really challenging in the sense that, I didn't really know how to study. And I had like these 4 classes, but I had so much time on my hands. So I didn't really know how to, effectively use my time in that sense. And so, I had this one shortcoming where I got this really bad grade in genetics, and that kind of like, just took the wind out of me. And at that point, I kind of had to kind of rethink my plan. And so pre-med didn't really appeal to me anymore at that point. I knew that I still liked the idea of medicine and wanted to be in some type of like a health type of a profession, but I really wasn't quite sure. So at that point in time, I just started doing some more research and then came across the Master's of Public Health and decided that I wanted to do that. And so I applied to a few schools, and my first choice at that time was George Washington. And so I moved to Washington, D.C., and I was in that program for about 2 years, and then I graduated. And thereafter, I started working for the federal government. So I was working for the National Institutes of Health at the time. I was doing a lot more HIV/AIDS grants research. And it was at that point that there was kind of like a little, a changing point for me. So I'd have these biannual meetings, and I interacted with like a lot of like, I should say our research patients. And so I just kind of loved the rapport that our clinicians had with them. And I thought to myself, I'd really like to do that. I felt so far removed in my position in the government that I really wanted more people interaction, wanted to kind of like impact change in some way. And so at that point, I decided, well, if I want to go back into this idea of medicine, like, where do I want to be with that? Is it that I want to go back into medicine, or is there something else? And that's when I came across the nurse practitioner role. And so I vaguely remember, like, I kind of at the time, like, remember that I had a nurse practitioner, and I just loved how I interacted with her. And I kind of resolved for myself that that's what I wanted to do. And so at that point, applied to a few programs and decided to go back home. So I actually started at a program in Boston. And what I'd like to say here is that I was essentially considered a non-traditional student. So I didn't kind of start at the bottom and kind of work my way through nursing. I kind of had a totally different career and decided to change careers. And so what's nice about nursing is that you can do that. You don't have to kind of start at the bottom. You can kind of come in at the middle. And that's exactly what I did. I actually went into a direct entry accelerated program. So it was a 3-year program. So the first year and a half, I learned the nursing portion. And then the remaining year and a half, I learned the NP part. So my specialization was family. And so thereafter, like once I graduated, I started working in community health. So I was working in a community health center for a few years. And then thereafter, I transitioned, I specialized because I felt that the community medicine primary care was just so broad that I wanted to kind of like really kind of hone in my skills. And so I was afforded an opportunity at a hospital in Boston where I joined a colorectal / general GI team, and I was there for a few years. And then I transitioned to Miami, Florida, and I've been here ever since. So I currently work at a hospital downtown, and I continue to work. I continue to work in GI, and now I am a motility nurse practitioner. So what I do now is I primarily see patients that have upper and lower GI issues. So that can range from acid reflux to constipation to pelvic floor problems. And so that's where I am now.
Wow. All right, so let's cut to the chase. Whole journey, which is amazing. I think I'm so happy. First of all, this is the real deal. You're already keeping it real with us. So I love that you didn't take the traditional route, which is nice because we always hear, the regular stories working their way up. So it's nice that you took a totally different approach, and look at you now. I mean, 8 years as a nurse practitioner, and you're still, you're killing it, and that's amazing. So let's talk about the real deal.
Yes.
First of all, what would you have done differently?
So for me, I'm not sure that I would have done anything differently because this is what led me to this career. Like at every point in my life kind of led me to where I am now. And I think if I had done anything differently, I probably would have been in a different field. So I don't know. I mean, in hindsight, you wish that you probably started in the field a lot sooner, and perhaps I could have been in a bigger role at this point in lifetime. But I don't know that I would have done anything differently because I'm not sure I would be here if I did.
That's awesome. And mentorship. So were mentors helpful along the way? What was your experience with mentors?
Yes, I had many mentors. And what I will share is that if you can, you shouldn't just have one mentor because you can have mentors for very different things. And not all mentors are created equal. So you may have one mentor that's very supportive in one thing, and they kind of like have an idea about something, and they can totally turn you away from something else. So it's really important that you have mentors that are very supportive and that really want to mentor. Because sometimes you'll find that people say, oh yeah, I can help you. And then when you actually reach out to them, they're not really helping you, or they're like nowhere to be found. So you really want to try to pair up and match yourself up with somebody that really is intentional, and they really are invested in trying to kind of see your success.
Exactly. A lot of times I think with mentorship, what can happen is you start to almost become, I don't want to say a puppet, but it's kind of like the person is kind of just telling you what to do.
Right.
And it's not about you anymore. And it's kind of just you becoming who they want you to be. So I think that's something that's very important. I think sharing the vision and knowing exactly who you are and what you want is important.
Right.
Yeah. So what about the misconceptions? What are some of the biggest misconceptions about the nursing profession?
So some of the misconceptions for me is that I don't really see, there's no real formality in nursing. Like, again, you can come in at different time points. Like I've known people that started as certified nursing assistants, and then they became LPNs, and then they moved into the associate degree nurse, and then the BSN. So there's really no like one cookie cutter way of entering the field. And then the other thing is that there's really no age requirement. I mean, I've interacted with nurses that started the field. Some are young and some are very old. So there's there's never a wrong time to start the field.
Yeah, oh, that's key to hear that. And I have to say, one thing I always hear about nurses is that they work long hours, and that's the only way to be a effective or successful nurse. Is that true?
That is not at all true. So you can be like I said, like because of how diverse the nursing field is, if you want to do bedside nursing, they do have hours where they're 12-hour shifts where you kind of work your 12 hours in some form. If you want to do them back to back, you can, and if you want to do more. So more or less you kind of control like how you work in that setting. If you want to be a 9-to-5 type nurse, you can do that as well. You can that would be more of a clinic type setting where it's kind of like the hours are 9 to 5. But nursing is so, how can I say this? Like there's so many roles that you can hold as a nurse. I know people who only work an 8-hour shift per week, just 8 hours, and they're probably making what I make. So the idea that you're kind of working these grueling hours and it's day in, day out, that is not necessarily true. Now, what I will say is that initially in the beginning, sometimes when you're doing bedside nursing, it may seem that way. And sometimes, nurses do work those grueling hours in the beginning to kind of perfect their craft. But once you've kind of honed your skills, like the world is your oyster. So you can kind of go into very many different facets of nursing, and it doesn't have to be like that typical 12 grueling, hours per day.
Yes, yes. And by the way, please, if you have any questions or comments, please feel free to type them in. We are going to have a quick live Q&A at the end, so please feel free to ask any questions you may have. So what is most challenging? What is the hardest part about being a nurse for you?
For me, I think the most challenging has been when you've interacted with a patient, and with everything you've done, like the outcome isn't going to be necessarily the greatest. And what you're doing is you're doing your best to kind of, give them the best care that you can for that moment. But it's hard because sometimes you often take that kind of patient experience home. And I can recall on several where it's like, when you're interacting with a very young person that's diagnosed with a cancer, there's no family history, and those have been kind of like the more challenging experiences for me.
Yeah, I can understand, especially now, with obviously we're so thankful for our nurses. Someone just left a comment, Sabina, thank you. We're so grateful for all of our nurses now more than ever. So,
right.
So it's definitely a very challenging and trying time, which on a lighter note, what is the biggest reward?
So the biggest reward would be the opposite of that. Being able to kind of meet someone that's not doing well and giving them an experience where like their health is better. They appreciate you. I can't tell you how wonderful it feels when you get the email or a little note or card that says, thank you for caring for me. Thank you for giving me your best care. It feels good. So even though sometimes you have patients that have like so much going on, and sometimes it can be very challenging to kind of figure out like what to do next. But when you get that little note or you get that handshake or that hug, it makes it all worth it.
Exactly. Now, how has the industry changed? You've been in the field for over 10 years, especially now, I'm sure. There isn't one industry out there that hasn't somehow been affected by the pandemic. But just overall, what changes have you seen in the industry?
So what I will say is that from like an educational standpoint, there is now a bigger push for programs to be more, to prepare more DNP nurses. So you'll find that a lot of programs are offering it, and there are a lot of programs that are also trying to phase out the master's. So what they're doing is that they're offering the DNP, and once you graduate, they kind of give you both degrees at the end, kind of thing. Okay. If we're talking about like what does the working landscape look like, given with this pandemic, like there's been such a boom right now, like for nurses, and like the salaries are like astronomical. Like there's been an exponential increase in how much nurses are being paid. I have friends that are doing travel nursing now, and their salaries have like tripled.
Wow.
Yeah.
That's amazing. Someone was actually telling me the other day that they're a travel nurse and they're making almost as much as, or if not the same as a physician.
And that is
a travel nurse.
And that's absolutely true.
Yeah, that is amazing.
Yeah.
And I guess that kind of leads into this question, which is there room for growth? So are you stuck in the hospital working long hours, which, I know, which is a misconception, but, how do you grow in this field?
So is there room for growth? Absolutely. So my, take home for anyone is that making sure that you have, an amazing mentor that is really invested in your growth, because sometimes it just takes that one person to kind of steer you in the right direction. Again, initially, I kind of thought that nursing was simply bedside nursing, but when you start to kind of interact with other people, you're learning from their experiences, and they tell you, the hiccups that they've had, you start to learn about other areas. So working at the NIH is where I like first met like nursing consultants. So these were nurses that were like consulting PhDs and doctors on what to do for clinical trial studies. So imagine that, like no one, if you're not really well versed in nursing, you would never think that you could, consult anyone, right? So this nurse, I mean, this one that I interacted with, like she clearly was well versed in research and knew how to prepare clinical trials, get them started. And so she was like the A person for teaching others on how to initiate a clinical trial. If you decide that you want to go into industry, even if you want to become an educator, you can do that. So like, there's nothing that you can't do in nursing. For example, I experienced working with a wound care nurse, and wound care nurses do very well in the industry. In the role that I am in now, I've interacted with infusion nurses. So infusion nurses are the ones that give you medication for sometimes for cancer patients, sometimes for patients that have rheumatologic or inflammatory type issues. And so there's so many roles that you can actually, there's so many different roles for nursing. So when you're asking about room for growth, there's absolute room for growth. It all depends on you. I always tell everyone, the sky's the limit when it comes to nursing.
Yes, and we see that. I think that's probably like the biggest takeaway here. But we actually have some great questions coming in, Morianne.
Yes.
So first question here is, what would be your advice to someone who already has a bachelor's in business and they're looking to go into the nursing field?
So if they have a bachelor's in nursing, I would say it all depends on their finances. If financing is like, if they don't have much to dedicate to the actual degree, going the associate degree route wouldn't be a bad option. And the only reason why is because you could get your degree at a community college for like more than half the cost of what it would cost for you to get it at like a local university. The other thing that you can do is go the route of an accelerated BSN program, and that's the 16 to 18 month programs, because you graduate with a BSN. Now, those are a little intense. So if you don't have a science background, just know that like you really would need to take time to like really devote to studying for that. But anyone that has a prior degree, I would probably recommend an accelerated BSN degree.
Okay. Okay. Another question we have. So night shift or day shift, which would you recommend for a new nurse?
So to be honest, the day shift is extremely hard, but that's where you learn the best of nursing. The best of nursing happens on the day shift. Like when it comes to wound changes, when it comes to when you're kind of interacting with the doctors, the fellows, the residents, and so forth, like when you're rounding with them, the best nursing care happens during the day shift. It's really hard and grueling, but you'll get the best nursing skill during the day. At night, patients usually mostly are sleeping. You're giving them their night meds, so there's really not much to learn at like during the night. Now, it's not to say that bad things can't happen at night where you're not having to use your nursing care experience, but in the beginning for a brand new nurse, I would say day nursing would be where you get your best skill set. But once you've kind of gotten everything and you transition to night, because night nurses make more.
Yes.
So for the financial piece, if you want a couple more dollars, then the night shift wouldn't be so bad.
Okay. Okay. Another question we have, which is actually a misconception piece. What is the gender gap in nursing? I mean, we tend to always see female nurses, but I know there is a growth in male nurses. What do you see?
Yes, there's still a gender gap. I mean, I can just recall my own program. I think there may have been like 3 males in my class. And I think I had a class of 50. Okay. And there were only 3 guys. So there's still a huge gender gap. And I think the nursing field, they're trying to do a better job of appealing to men. So there are a lot of scholarships that are out there to kind of get more men into the field. So there's a movement to get more guys in, for sure.
And I think that's also opportunity knocking for my males who are tuning in.
Yes. So if I could say this to all the males, because males, like some of the males that I interact with, they have this idea that it's like a woman's type field, and it's not. Remember that you can go into very different roles. Like you can become a nursing informatics person, like where you're dealing with the system, the the electronic medical record and trying to make it better for like a hospital. So you don't have to kind of do the bedside thing. If you're not really into the nursing care, like, you know, the patient, you can move into very different roles in nursing.
Wow. And then we have a really great question here. How can female nurses, or maybe even nurses in general, use this pandemic as the catalyst for more advanced positions in leadership? So I know I always hear that usually when there is crisis, there's also a lot of opportunity. And I think you kind of touched on that a little bit. But is it working as a catalyst for advanced positions in leadership in the field?
So I think we're trying to do a better job of that. I will say this, that again, with the push for DNP prepared nurses, we have many different types of DNP programs that are out there. There are a lot of them that are focused on executive leadership, like providing the leadership skills that you need to kind of hold positions like a CNO, to be like a nursing executive as a hospital, or to be in charge of like the nursing department at any particular hospital. So I think they're doing a better job of trying to appeal to folks that want to go into leadership. You can actually delve into these various programs. They do have a few that are at the master's level, but as you know, when you're going into leadership at a hospital, you're essentially competing with, you know, the medical directors, so those folks that have like medical backgrounds. So the one thing I will say is making sure that you have a very diverse professional work experience will help you, and also education.
Okay, awesome. So I guess what would be your biggest advice or greatest piece of advice you could give to someone right now who's either thinking about entering the nursing field or in the nursing field and kind of feel like, you know, they've hit like, you know, this they're at a dead end. They don't really know where to go at this point. What can you tell them?
So essentially, I would tell them that, you know what, given the diversity of nursing, that you're not stuck in this, you know, like in any one box. Feel free to move outside of that box. Trust the process. So if you're thinking to like move into something else, do your research on it. Like find people who are willing to mentor you. Like find good mentors that are like really that are going to challenge you, that are going to say, hey, listen, look into this program. I would say that, again, the most important piece is trust the process, because a lot of times you go into these programs and sometimes it's hard work, and you have to be committed to the hard work. And as long as you're committed to succeeding, you will succeed. I have this one little short story that I'd like to tell. So I was in school with this young gentleman in NP school, and he was actually a year ahead of me. And like language was a huge hindrance for him in our program, and so he didn't quite pass. And so at that point in time, our administration decided to kind of help him along, and he had some difficulty with passing like the NP part of our program. And so because he had completed all the nursing classes, he tried for the NCLEX, it didn't work out. So at that point, you know, he tried and tried, like maybe he had taken the exam maybe about 4 or 5 times and didn't pass. And so at that point, they decided to say, well, you know, since you've taken all your courses, what we can do is help you to at least be certified as an LPN. And that worked in his favor. And so he actually studied for the LPN with what he knew from, you know, like what we would call at the BSN level, and he passed the exam. So he worked as an LPN for many years. And every so often he'd go back and try to take the NCLEX exam to become, you know, the BSN. And he tried and tried, and he was committed to the process. Like, and I would say that this went on for a good like 10 years of him trying. And he recently called me, I want to say a few months ago, and told me that he finally passed the NCLEX. So
Wow.
I know for a lot of you that you may think that, hey, like that was way too long of a time for me to like, you know, wait to take an exam, like to actually pass an exam, but he was committed to the process and he eventually passed. So
exactly, his persistence paid
yes.
off.
Yes.
And he trusted the process and it worked.
Yes.
It worked. That is awesome. So we are wrapping it up. Thank you so much, Morianne. You have given us so much insight. You kept it real. You made it so relatable. Thank you so much for joining us tonight. And I want to thank all of you guys for tuning in as well. I hope you guys enjoyed the show. If you haven't done so already, like I mentioned before, please be sure to register by going either to our website, www.studentproconnect.com, or downloading the app, which is available on the Google Play or App Store. Thank you, Maurianne.
Thank you for having me. And for all you Student Pro Connectors out there, if you ever like have a question, whatever it may be, if I can help anyone to join the field, I am here for you. So if you need anything from me, you can, I think I'm on the site, so you can connect with me that way too. You can send me a message or however. I'd say connect with the Student Pro Connect people and they can get you in touch with me if you just have any other questions, whatever it may be. I'm here for you.
Thank you so much. And guys, those people that are listening, please look out. We will be having a new show in about a week or two. It's going to be on March 24th. So mark your calendars, March 24th, same time, 7 p.m. And we will be featuring a teacher. So if you're interested in education, please share that with them. Please look out for that flyer. Visit our social media pages and please register. Thank you, everyone. Have a great evening.
Thank you.